So probably the most common procedure in electrophysiology today is ablation of atrial fibrillation. And what we do in ablation of atrial fibrillation is we cauterize around the veins that bring blood from the lungs into the heart. And that's called pulmonary vein isolation. And that's been the cornerstone and the most effective way to prevent recurrences of atrial fibrillation. Actually, when I was training, it used to take 4 to 6 hours to do this. But technology has gotten so good that we're able to do this in under an hour and able to do it with little or no radiation. And the things that really have helped do this are the quality of the mapping system we use, the quality of the catheters that we use. One of the big advancements in catheter ablation, the catheter we use for ablations is contact force, so we know how much pressure we're putting on the heart tissue. Another big improvement in timing for this is the accuracy of the magnet, so we can tell within millimeters of where the catheter is within the heart. Also, the ablation strategy we use. Up until now, there were different ways of cauterizing that tissue. And in radiofrequency ablation, we went from catheters that were non-irrigated to catheters that were irrigated, and then we were able to fine-tune the type of irrigation, the type of wattage we use. So every lesion is much, much more effective than it was even 5 or 6 years ago. So we're able to take this procedure that would take, again, 4 to 6 hours, and we're cutting it down to 45 minutes. And patients are able to leave the same day, and they love not having a hospital stay, because a hospital can be a pretty daunting place. It's hard to sleep, but you go home, you rest in your own bed, and it really makes for a much more pleasurable experience. Furthermore, you get less anesthesia. When we do atrial ablations, we're able to do all this cool stuff and ablate the heart without, making any big incisions or whatnot, because patients are under general anesthesia. They don't move. So when we're able to keep the procedure short, we're able to keep the time under general anesthesia short, so the effects of anesthesia or the ill effects of general anesthesia are not felt as much. So you get less complications, better recovery time, and overall a much more pleasurable experience.